Hello everybody and welcome to the HacettepePathology.com and case of the month in the case of the month series. Today I'm going to share you a 16-year-old male with a proximal tibial mass. Here you can see the irregularity of the anterior surface of bone and some periosteal reaction and some bone formation also occurs here, and in the MRI you can see both the intramedullary and periosteal mass, and it's resembling osteosarcoma. In the microscopy, the tumor is composed of two different zones, one of which is such a myxoid areas and hypocellular area like this, with abrupt transition into, or in some areas, a gradual transition into more hypercellular zones composed of short spindle or small neoplastic cells, accompanied by prominent hemangioplastic vessels. And some of these vessels has archiform structures like this here. They form archiform structures. And when we go high power field, there is neither pleomorphism or mitotic activity in the neoplastic cells. And actually the first thing comes to my mind was low-grade fibromyxoid sarcoma or sclerosing epithelial fibrosarcoma, recently described in bones, and therefore I performed a book for staining, which was negative, and then I ordered a HacettepeP2, and which was positive, again high power, and TLE1, because I considered a Ewing-like sarcoma, but nowadays, it's so-called Ewing-like sarcoma, what nowadays we refer to as undifferentiated small cell sarcoma. And SIGDUX4 is one of the entities in the undifferentiated small cell sarcoma, but this one is B-core CCMB3 sarcoma, which is characterized by co-expression of TLE1 and HacettepeP2 immunohistochemically, and of course then we did CD99, which excluded the staining pattern, almost excludes the Ewing sarcoma, because the lack of strong and diffuse membranous positivity. In this case, we have this cytoplasmic or dot-like immune expression of CD99. Interestingly, this case was B-core negative for B-core immunohistochemically. Then we ordered an RT-PCR. Here's the band for this is our case, and this is positive control case. This is negative control, and this is beta actin, and we see this band referred to at 140 base pairs like here, and this is the band for the fusion product of B core CCMB3. These tumors are mainly found in the soft the bones, in contrast to CTOX4 sarcomas, which are commonly seen in the soft tissues, and these tumors are seen in the young adults and childhood, and they have different various they show various morphologies, but short spindle cells and small round cells within a myxoid background should pop up the diagnosis. Thank you very much.